Welcome back to Great Day SA. Now, before we start this segment, we would like to warn you we will be covering adult matters. So if you do have little ones in the room, you may want to please escort them out. Our next guest is an associate professor of clinical medicine at UCLA, former team physician for the LA Raiders, and he has been featured in several weight loss shows like The Biggest Loser and Extreme Makeover.
But today he's here joining us to talk about a topic that has a big stigma attached to it. I want to welcome Dr. Robert Huizenga, better known as Dr. H.
Thanks for having me.
Thanks for being here. We're pumped to hear about your book, but what's in it and just in general, everything you're trying to spread some good knowledge here.
There's so much stigma. People won't talk about it. Doctors are afraid to talk about it. We have to end this insanity.
How is that even possible that even doctors are afraid to talk about something like this?
Doctors don't take proper sex histories anywhere in America. They're asleep at the wheel. They often don't do the right tests. People come in and say, I want everything done. And they often don't do tests for herpes. They don't do tests for mycoplasma. And people leave saying, oh, I don't have an STD. They may have HPV. They may have tests the doctor never even looked at.
So what do you think are some of the biggest things that are overlooked for, or even the biggest stigmas out there when it comes to an STD?
Well, I think the biggest thing is that we have a huge problem. Every year in America, 25 million Americans this year are going to get a new STD.
That's a crazy number.
This is the insane thing. And I'll ask you, what's the #1 way you think STDs present?
Like a bump?
Right. People think a bump, a rash, some sort of discharge. No, the #1 way STDs present is no symptoms at all. That's why if you're at high risk, if you have a risk of it, you have to get routine testing. No one knows that.
But doctor, that's also why so many people say, I don't have anything, there's nothing that I'm showing, I'm completely clean. But so many things, especially with social media apps, dating, it's so easy now to
get... The number of hookups have markedly increased compared to even 10, 20 years ago. And the public health systems that used to track people with sexually transmitted disease, they can't even do their job because some people say, yeah, I have an STD, but I don't know the name, I don't know the address of the individual that I had sex with.
So why do you think people are letting go of that protecting themselves? Why are they letting themselves just be so loose and not care that they could possibly have an STD and possibly give it to someone, which could ruin their lives?
Well, I think it's because they're unaware. People assume because they have no symptoms, they have no problems. That's absolutely false. People have to know that HPV, probably 95% of us have HPV in one form or another, and that's the worst STD right now. It's worse than HIV. 13,000 Americans this year are going to die from HPV. Cervical cancer, rectal cancer, esophageal cancer, and throat cancer, like Michael Douglas.
That's what HPV can
Human
create.
papillomavirus creates cancer. It's a cancer-causing sexually transmitted disease.
Now, doctor, you were featured alongside on the Today Show with Charlie Sheen. And we would like to show everyone, just to give you a refresher of this interview.
Charlie does not have AIDS. AIDS is a condition when the HIV virus markedly suppresses the immune system and you're susceptible to rare, difficult cancers and infections. Charlie has none of those. He is healthy. His risk of advancing...
So, doctor, you got a lot of backlash as a result of this interview. Why is that?
Well, one of the things Charlie said on national TV was that he had sex with several girlfriends without a condom, and he admitted he had HIV. The internet, as you can imagine, blew up. People don't know. We've made huge progress with HIV. The drugs, if taken properly, make the transmission impossible, or maybe 1 in 10 million, so that your chance...
So it's not really a death sentence.
It's
I think
not
that's
a death
big
sentence
misconception
anymore.
that people have, is that my life is over. I can't live anymore. I don't even want to be here. But this is something that we've come a long way.
We've come so far that when I started out, it was a death sentence, and now, if you're taking proper treatment, the problem is half of people in this country, 500,000, have HIV, don't know they have it, or are improperly treated, and they can pass it. So that you, as a young woman, if you were single and you went to a bar and you picked up the best-looking guy there, if you use a condom, condoms only work 80% of the time, and so with 500,000 people at risk, your chance of getting HIV is higher with protected sex, because condoms aren't 100%, than with a person fully treated, and people don't know that.
So what is your best advice for prevention then? What are we supposed to do if
we have to identify people at high risk. People at high risk are heterosexuals with multiple partners or a new relationship, men who have sex with men, women under 30, huge incidence of chlamydia where they're just walking around with it, individuals that that drink excessively or take drugs with sex, and women that are pregnant. There's 2 people at risk. Those people need routine tests every 6 months, at least every year, and then we can eliminate this scourge that's rapidly increasing over the last 4 years.
Now, doctor, this is a really, really difficult conversation for a lot of people to have, but when you do have that encounter with that person that you just met, great chemistry, they look like a good person, and they say, oh, I'm clean, I'm good, my past relationships have been, they've been my friends, I've known them forever. How do you get to that point
Worthless,
to say,
worthless.
So what do you say?
I think that you say, I want you to do a complete test. I'm going to do a complete test. The worst thing is when people come in and say, I want this guy, a rock musician, for instance, that I talk about in the book. I want him to get tested. I know he ended up being okay, and the other individual had multiple issues. Both partners need to get tested. You don't just bring your partner in, and you have to go to a doctor and tell the doctor, I want everything done. I want herpes, I want mycoplasma, because don't let the doctor lull you.
Wing it, because then he might not get, or she might not get exactly what you're looking for. But the crazy part is you can get STDs through things you probably would never even think about, right?
Well, I think the biggest misconception is if you remove hair in sensitive places, you abrade the skin, and that increases the risk of skin-to-skin STDs like syphilis, like herpes, like human papillomavirus, because the skin isn't a correct barrier. And so you really should do that type of hair removal at least 24 or preferably 48 hours before contact.
Now, doctor, what if someone at home right now is watching and they're thinking, I might have had a risky encounter. When do you need to start getting tested? How soon can you get tested to be able to get good results?
Unbelievable question, because people they come to me as a doctor and they say, I'm not sure about this person I was with 3 days ago. Well, the tests don't all turn positive usually till 3 or maybe even 4 weeks. And so you can do a test right away, especially with symptoms, but you really need to wait at least a month afterwards to be sure.
Symptoms or no symptoms, you need to do this test.
Correct, you need to do the test, and please learn about it. How can people talk to their kids when they don't know very much, if anything, about sexually transmitted diseases?
That's another big thing. Parents are so scared to talk to their kids about it, saying
the kids know it, they're on the internet. Please, let's get to kids, let's get them vaccinated, and let's do the prevention.
No bees in the talk, just
Forget
get straight
that.
to the
Well,
point.
I think
Let's
we've
be
moved on
honest
from
here.
there.
Absolutely. Well, we appreciate you so much for
Thanks
being
for
here.
having me.
We could talk forever with him, obviously. But make sure to go get Dr. H's book over on Amazon. That's Amazon.com. And hopefully next time you're in San Antonio, you can come visit us, doctor.